Hello, my name is Dr. Jason from Carolina Value Pet Care. Today, I'd like to speak with you a little bit about dogs and heartworm disease. So, it's one of the first questions we need to think about is how does a dog even get heartworm? So, I hear these, it sounds pretty bad. You're saying it's a heart and a worm. Like, hearts are pretty important, right? So, I don't want worms getting in there. So, heartworms are actually transmitted by mosquitoes. So, mosquitoes carry this kind of immature form of the worm, kind of really, really tiny. We're not going to see it small enough where it can kind of circulate in our dog's blood. So a mosquito comes, they'll bite your dog. As the mosquito is actually biting in the saliva, it can actually pass these little things called like microfilaria. So it's a very immature form of a heartworm actually in there. So it gets out of their saliva and now goes into their blood system. So it goes into those little vessels that they were just trying to get their meal from. Now they've introduced that type of immature worm into the body. So down here in the south, unfortunately, we see mosquitoes year round. So there are a lot of these heartworms out there, and we do see a lot of dogs coming down with heartworm disease if they're not on a good preventative program. So then also, what's going to happen? So while we get you on a good heartworm prevention, our recommendations is we want to get you a heartworm test at least every 2 years, as long as you're on your prevention kind of year-round control. And we still want to test you every 2 years just in case. None of our medications are going to be 100% effective, so we want to making sure nothing slipped through the cracks during that time. So we like to test this as a little tiny blood sample. We just need a couple little drops of blood. We put it on a little thing, takes 10, 15 minutes or so, nice and fast, and we test them to making sure they don't have heartworms. These tests are actually checking for a protein that adult females will actually put into the blood. So if that protein is present, it'll come back positive on our heartworm test. If it is positive, we would let you know, and then we kind of have some options on how we want to treat heartworm disease. Kind of talking about two different options. One would be called like a slow kill or a fast kill. We do like to get them out of the body as soon as possible. So there's an American Heartworm Society where it kind of goes through all these gurus of heartworm disease. They do still recommend, ideally, we do that fast kill approach. That is going to be something that we would refer over towards one of the local general practices. It's kind of a more full service clinic that's not just a vaccine clinic like ourselves, where they could do that whole protocol for you. But initially, what we do, we get you started on an antibiotic called doxycycline. There's actually a little bacteria in these heartworms called Wolbachia, kind of fun word to say. But that little bacteria can also cause some issues too. So we want to get you on an antibiotic to making sure that bacteria is gone. Then we're going to keep you on a monthly heartworm prevention until the next couple months. And in a couple months period, then you would have the option to do that fast kill method. The slow kill method just takes longer for us to get rid of the worms in the body. So the longer they're in there, the more chance they might do some harm or something too. But cost wise, it definitely is a lot easier on the wallet or the purse or something too. So sometimes we'll pick that slow kill method, which is just kind of doing our heartworm prevention year round, do that initial dose of that doxycycline, that antibiotic. And what we're really doing is waiting for those adult worms to die off on their own. May even take even 1 to 2 years before they're all gone out of the body. So that's what's going to happen if you test positive while you're in one of our clinics. What happens if we don't treat them? So what if I don't do that fast kill approach? I don't do that slow kill approach. Unfortunately, what happens with these worms, these adult worms, they start off, and as adults, they'll actually go and get into the area of our arteries in our lungs, so the ones close to the heart. So they're going to cause some inflammation. They may cause some coughing. The more and more those adults keep growing and making new little babies and more adults, they're actually going to start backing up and can go into the vessels of the heart themselves. That's where they got this name heartworms from. They get into the heart themselves. Now we're causing inflammation in the heart. That can cause some chronic secondary changes in the heart, as well as the stuff we're seeing in the lungs. So we want to get them out of there as soon as possible. So what can I do to prevent heartworm? It's actually pretty easy to prevent these guys. So there's oral medications or injectable medications. There's even some topical medications, especially for our cats. We don't use many topicals for dogs, but there are some other options out there. There's an injectable called ProHeart that's given either every 6 months or once a year. is one of those options, or the oral medication that we take once a month. The once a month kind of keeps us protected against any time throughout the month that a mosquito might have bitten our dog. Now we can kill them all off every month before they get to the adult stage, before they can do any harm. Do all dogs need heartworm prevention? Down here, I would say yes, unfortunately. So, up north, I used to work kind of New York, Pennsylvania, Illinois. We had different seasons, and we didn't see mosquitoes for a good 4 or 5 months of the year. And sometimes we would get them off during that time. But down here, we do see mosquitoes year round. So I like to keep them on heartworm prevention year round to protect them. Even if they're indoor only, they're still going outside to pee and poop. You still have the chance of mosquitoes coming in the house that could bite them and transmit these things too. So I would definitely recommend all dogs need to be on heartworm prevention. How often does a dog need it? Like I said, it really depends on which product we're going to use. Are we using that 6-month injectable product? Is it a 12-month injectable product? Or is it going to be one of these every month products that we give them? The nice thing about our every month product is a lot of times it's also mixed with a deworming medication in there too. So we can kind of combine our heartworm prevention with our intestinal parasite prevention. Some of them combine some flea or tick control. So we really can tailor things around what you think is going to be best for your own dog. All right. If you have any other questions, take a look at our website, www.carolinavaluepetcare.com, or take a look at our clinic schedule. You can come in person and ask us any questions you have. Thank you.